This episode is brought to you by Midol. For anyone who's ever powered through sakit sa puson, back pain, mood swings, or that full body blah feeling, you will want to stick around. Midol targets pain at the source with multi-symptom relief para mawawala ang sakit sa puson and other kinds of period pain like backaches, headaches, and sakit sa katawan. It's been our go-to since forever. So whether you're trying to survive a Zoom meeting, shooting all day, or curled up on the couch, mask on or mask off, kaya mo with Midol. Before we open, Ava has something to say.
She wants me to repeat that Luch told me that she looks good in their bangs.
Stop it.
You're stupid.
Okay, go.
Can I more money? Hey, welcome back to the Sexytime Podcast. I'm Ava, your favorite host.
And I'm Belle, and today we're finally talking about something that's been with us since high school, and for some of us even before high school. I have friends in grade school.
Really?
And it's not our exes. We're talking about what's it like kapag meron ka. Hence, the colors today.
Yes.
Naka-red tayo.
Yes, the cravings, the low energy, the I love you, I hate you roller coaster, and the pain that creeps into your back, your belly, and your whole body.
Okay, so let's be real. We've all had these moments na gusto lang natin humiga and to sleep inside our rooms and not go to work.
That's not just when I have my period.
That's just all day lang.
Every day.
That's you right now, basically. Or those times na masakit yung puson natin and we have to endure the pain that comes with being a woman.
And you have to go to work, do meetings, and put on a good face. Like, that is actually the worst thing ever.
Yeah.
Right?
I mean, I think just that is one of the things as a woman that we have to endure.
Yeah. Like,
and men will never understand the pain.
Super.
Look at all
when
our
Luch
camera
tells me to
crew.
do something, I'm like, do you get your period? You have to deal with those things, huh? And
Okay.
like, I always win the argument just by saying that. But, you know, you just have to power through. It's so tough.
Yeah. So, let's make kwento first about period horror story. I'll start. Okay. One time, oh my God, this is so embarrassing. So one time, I remember so clearly, I was wearing a white mini skirt. I don't know what I was thinking. Kasi, alam naman natin itong mga babae, when we have our period, we never wear white. It's like an automatic rule.
It's weird. I only like to wear white when I have my period. That's
Iba
weird.
ka.
Iba talaga.
That's weird. So, diba, normal women
you
and
know,
normal
like,
girls, you know, when you have your period, I'm not gonna wear white kasi
Yeah.
baka matagusan ako. That's something that we have to deal with. And for some reason, I just thought to be adventurous. I don't know. I wore a white mini skirt before my shoot. Ayan, I was sitting for makeup. And I was,
Cute ka pa kasi in white.
cute ako in white. And then when I stood up from my makeup chair, oh my God.
Who told you?
My makeup artist, and then he was a guy pa at that time, so he didn't know what it was. And he was like, I think may something ka, meron ka something. Ano yan? Parang he was like
he
trying
touched
to...
it pa.
Yeah. And then I was like, oh my God. And syempre, only I knew what it was because I'm like, oh my God, natagusan ako. Yeah.
Dead.
In the end, obviously he was my friend, he was my makeup artist also, and thankfully he was so sweet. And we were just a small group of people who were there. Syempre, your glam team, your makeup, your hair and stuff. But it was so embarrassing because I needed to change my skirt.
Yeah. Oh my God.
And then, ang tanda ko na, I think I was like 22.
Oh, I hate the ghost stories. That's always my number one. Actually, Mom told me one story of hers in a party and she was dying down. She's in white also. So, for my most disgusting story, which I was reluctant
We're not naman talking about disgusting.
No, the most embarrassing. This was in Canada. I don't know if you remember this, but we were with our cousins, and I guess it was like...
And it was on the bed.
No, that's not even embarrassing. That's like every day.
Normal.
It's like normal.
Normal.
No, I was, I guess in my you're 14, you're still trying to be cute. We were like in and we were running around swimming. And I had my period, and I didn't, and I wasn't wearing tampons before when I have my period. So you'd wear napkins, right?
Yeah.
So we went swimming, and then we happened to be playing, I guess, Marco Polo, and you run out the pool.
Yeah.
And there are like other cute people in the area, and then it was my turn to, I was chasing everyone else around there, and all of a sudden here, And I turn around and I'm like, oh my God.
It was your napkin. It became a diaper.
Yeah, it was so bad. That was really
First of all, you shouldn't be swimming with a napkin on. I swear, the crew is like, they're squirming in their seats.
By the way, we're filming with 6 men here.
Yeah. But okay. But, if ever in the future they have children or they have wives who go through this, at least maiintindihan nila what we go through.
Every
when
girl
we get
has had this experience, I'm sure.
And every girl, for sure, if it hasn't happened yan, mangyayari is matatagosan sila. Sorry to say. It's just like a rite of passage that you go through.
I want to tell you one more story that for me was really, really difficult because one of my most memorable period stories was in college. It was my thesis, and I was it was your thesis defense. And with thesis defense, you kind of just stay up for weeks of just like practicing what you're going to say, what happens, ganito. So like the whole week I was studying, rehearsing everything I was going to say. On the day of my thesis, I remember I woke up and my back was so painful. I was like, oh my God, no. I had dysmenorrhea. And it was the worst kind of dysmenorrhea because other times I don't really get, I never really got debilitating, but this happened to be like
right before your thesis paper.
Thesis defense. So I couldn't even just like make it up. I had to talk to my teacher, defend my topic, and think basically while going through the most painful dysmenorrhea I've ever had. And I was like, I hate being a girl right now.
Yeah. You know what? That is something that we don't know how to deal with. When we have pain, we just power through it. But alam mo yung feeling pag may masakit sa katawan, yun lang yung pinag-uusapan mo buong araw. I'm sure you guys are all like
So
that. Like
true.
when you're like, how are you? Ewan ko, sakit ng likod ko. It's painful. Or like, I have a headache or I have this. It's when we have pain, it's all we can talk about.
I couldn't tell my teacher pa, like he's a guy. I'm like, sir, blood.
Ako naman, my pinaka-memorable period pain story was because I used to play for DLSU football. I played 2.5 to 3 years with the UAP team. That's
until you
flex.
quit because you're lazy to train. Just kidding.
Yeah. No, until I
you
quit
were
because
good.
I wasn't passing algebra na. I'm trigonometry.
Was this a moment of realization?
Yeah. I was like,
okay,
I'm
you're
third
good.
year. No, so I was training for UAP, De La Salle, and we were winning. We were always champion. But then there's one game. It was uni games in Bacolod, and my coach was like, you need to go on. And I was in so much pain. Like, alam mo yung cramps na I just couldn't move. And I told Coach, I can't. I have my dysmenorrhea. And he shouted at me. And he was like, wala akong pakinsyan sa dysmenorrhea mo. Get in the field. So I had to run. And I was warming up. And ang sakit-sakit ng tiyan ko. And at that moment, I felt the weight of having to have this pain in my belly, but also under the sun, under the heat. Tatakbo ka and you have to like run after this ball. I was like, I hate this sport. Why am I here?
Yeah.
All because of that period pain, which we will all go through or have gone through.
Well, we'll talk about it some more.
Yes.
Deeper into this convo. But for now, let us introduce our guest for today.
Joining us today is Dr. Elva Uygongco. Is that how you pronounce it?
Yeah,
Uygongco.
that's correct.
She is an OB-GYN and an expert in all things related to reproductive health. Sorry that we took up your time while we were making cuento our period pain.
No problem. I could totally relate.
She was like there. She was like,
what's
yes.
your painful story?
Imagine having to go through dysmenorrhea, but you have a patient in labor who's in more pain than you.
Oh my God.
Oh my gosh.
No, you've had that?
Yeah.
That's insane.
So that's the definition of powering through. Well, you have to.
You have to.
And-
Sana naman.
Yeah.
I'm giving birth here.
Exactly. And you can't tell them, wait, I'm in pain.
yeah.
So, Doc Elva, can you tell us what exactly causes dysmenorrhea? Like,
Or what is dysmenorrhea? What if a girl is listening to our podcast with her boyfriend who doesn't know what dysmenorrhea is?
Tama.
Can we start with that?
That's a good question. So dysmenorrhea or cramps happens during menstruation. 95% of women experience this dysmenorrhea.
Okay.
But 10 to 30% of women experience a more severe form of dysmenorrhea.
Okay.
And it's during this time that they have to go and look into what's causing the pain, why are they in pain, and they have to seek treatment. I guess one of the common themes among all of us and a lot of women is I've been told like to power through it, but there are things that we can do to actually address
alleviate
it, right?
the pain.
But what exactly causes the cramps? Like, is something being squeezed inside your tummy that causes the blood to flow? I actually want to know.
So there are
The science behind
actually two definitions of dysmenorrhea. You have primary dysmenorrhea and secondary dysmenorrhea. So before you even consider primary dysmenorrhea, you have to rule out secondary dysmenorrhea causes, which is caused by anatomical abnormalities in your uterus.
Okay.
So things like myomas, adenomyosis, endometriotic cysts,
Okay.
pelvic inflammatory diseases. And it's when you've ruled out anatomical problems like that we can look into, it's probably primary dysmenorrhea.
Okay.
Got it.
So I know endometriosis cysts, they are formed in the uterus, diba? And sometimes they stop people from getting pregnant. Tama ba?
Yeah, so endometriosis is a disease wherein the lining of the endometrium, the cells, right, that causes you to menstruate, kind of migrate to different parts of your body. The most common form is endometriotic cyst, which is in the ovaries. Sometimes they can even migrate to like other parts of the body, like the lung.
Yeah.
Yeah.
And how do you remove it? Do you have to do surgery or you take pills?
So you take medications to actually decrease
I
like
know
the
a few
inflammatory symptoms of endometriosis. The trend nowadays is more medical management versus surgical management.
I love
because the surgery,
better.
yeah, the surgery doesn't actually remove all of it. You can get like microscopic implants that won't be able to be removed with just
Yeah.
the surgery.
Okay.
And I just know, because I know a couple of people who have endometriosis, it's excruciating pain when they get their period.
Yes.
Like,
yes.
I don't see my friend every time she has her period
yeah.
at certain days because she has it.
Yeah.
Because she has endometriosis. And then one more thing I learned is one of the cures, and tell me if I'm right, is to get pregnant. But it's also really hard to get pregnant.
Yeah, so endometriosis can actually affect like your fertility in the long
Okay.
run. So that's why it's hard to get pregnant. But there are studies that actually show that after you get pregnant, like endometriosis symptoms and primary dysmenorrhea symptoms actually decrease after you get pregnant.
And is
Yeah.
there a reason behind that?
It has something to do with like the hormonal changes that your
Okay.
body underwent. Yeah.
So, okay, endometriosis. What about PCOS? PCOS is like a very buzzword right now.
Yeah,
Sorry.
I have PCOS.
I have PCOS too.
Oh, sorry.
That's
But
how you go around the
people are
terrace
just
socializing.
using
You have
PCOS.
PCOS.
Yeah.
So with PCOS, that's the abbreviation for polycystic ovary syndrome.
Mm-hmm.
So the common misconception is PCOS can also cause pain, but that's not necessarily true. The pain can just be due to the primary dysmenorrhea. The PCOS is an irregularity in your hormones
Okay.
that causes like multiple follicles to form in your ovaries, and then it causes irregular menses, hormone imbalances that causes you to gain weight, gain a lot of pimples.
Diba I told you when my doctor saw me, he's like, you have PCOS. He's like, ang taba mo. I'm like, oh my God, you can't just say that.
Did you?
I did. I did. So in the end, I did pala. But it didn't affect me. I mean, I just found out I did. But anyway, you're saying, so hormonal imbalance, so you
Yeah.
gain weight,
Yeah.
and then you get pimples.
Yes, and
Nako,
then
that's
you,
all you.
and then you get hair
Kapal
growth,
mo, ah.
especially
Hair
like,
growth?
yeah,
That's
here
her.
in the upper lip, the chest area.
I just had it
PCOS
waxed.
pala.
Excuse me, I'm very makinis.
Ay.
No, okay, what about pain? Dysmenorrhea, it always comes with different sorts of pain, like back pain, headache. Is that a normal thing?
Yeah, so let's go back to like explaining what primary dysmenorrhea
Okay, yeah.
is, right? So we have to understand that during our menses, there's different types of hormones that come into play
Okay.
to like trigger everything that's happening in your body. Hormones are the way for like different organs to communicate with each other. So before your menses, the levels of estrogen and progesterone in your body shoot down. And this
Okay.
is what actually prepares the body, okay, I'm going to menstruate. So before the menstruation, a hormone called prostaglandin is released.
I've heard of it.
Yeah.
Okay.
And this is what tells your uterus. Your uterus is basically like a large muscle. That's how
Okay.
it can expand to accommodate the baby.
Yeah.
Right. So the prostaglandin tells your uterus to contract, the muscle fibers to contract,
Yeah.
so that the lining of the endometrium sloughs off.
Okay.
So that when that lining sloughs off, that's when you bleed.
Okay.
So
I'm lost. Nasa na tayo? Okay.
oh, let me
I'm
try
kidding.
to
I'm
let me
kidding.
try to like
No.
Can you say it in layman's terms? She needs to. Just kidding.
No, so the pain
Yeah.
in the back, I'm just seeing where it's related. So the
No,
pain in the
first the blood comes out because of that.
Yeah.
We're not
Okay,
still
okay.
even there.
Yeah.
Obviously,
Yeah, we're
Kaya
not-
pala
we're
I'm
not
lost.
there at the
Na-lost
back
ka
pain.
na.
Okay. We're talking about
the prostaglandin.
And you wanted to be a
yeah.
medical student.
yeah, no, the prostaglandin. Go.
Yeah, so the prostaglandin triggers your
Okay.
uterus to like contract, and the
Okay.
uterus will like, okay, I'm gonna push out all this lining, all this blood. That contraction is what causes the crampy feeling that you feel.
Contraction similar to when you give birth?
Yes. So
Did you feel that?
But
I did.
birth contractions are like worse.
Really?
Yeah. So
scared.
when the prostaglandin triggers like the contractions, it also like promotes decreased blood flow in the area, and then it triggers pain receptors. Right. And the longer that this is happening, you'll get referred pain to your lower back. So that's why when you get very severe pain, you also feel it in the lower back. And it's very similar to when you go into labor. If the contractions are strong, you're going to feel it
In the back?
In the back. Yeah.
Oh my God. But if you get like deeper, more intense pain, is that a sign of something else? Like some people have like kind of superficial dysmenorrhea, but others are more intense. Endometriosis.
So that's why we have to like look into what the symptoms the patient is experiencing.
Okay.
One of the first common questions a lot of OBs ask you is, do you experience pain during your menses?
Yeah.
And then
That's always asked by your OB-GYN.
yeah, and there's a reason because we have to investigate if there's another reason causing the pain or it's just your primary dysmenorrhea.
What are the tests that you can do to find out?
So a transvaginal ultrasound will actually
TVS.
rule out a lot of the causes of your secondary dysmenorrhea.
That's when they stick the camera in your vagina
Yeah.
to look inside.
yeah,
and then
yeah.
what do you look for?
So you look for like signs in your ultrasound that tells you, oh, they have a myoma. Oh, they have an endometriosis. So it's
Pag walang signs,
pag walang
cleared
signs,
ka
so
for
everything is
primary.
normal. Yes.
You know, I was just thinking as a doctor, you have to think, okay, if they have pain, there's two options. Diba? So it's like primary. How do we rule out secondary? So that's what you're doing. It's like kind of like Xing everything.
I guess that's how doctors really work.
Yeah. It's like, okay, it's not this, it's this. Okay, since we're talking about pain, what about relieving the pain? Are there any tricks or like home hacks?
You just have to power through.
Or you just have to power through when it comes to alleviating very specific dysmenorrhea.
So with regards to relieving the pain, the most common form that's recommended is like warm compress.
Oh my gosh! In the clinic in school,
I was just gonna say,
my stomach hurts.
in the clinic.
They
give you a warm
Can I sleep
compress.
for an hour?
Yeah. Tama.
Yeah.
Tama. And then we get sleepy also, no?
Yeah.
Baka
Well,
we're
I
just
mean,
sleepy.
warm compress is, I guess, like a home hack. But I'm always like, can I get a Midol?
You know what? Midol is the brand that was very prevalent when we were in high school.
Yeah,
It was the brand for women or like teenage girls who are experiencing dysmenorrhea.
that's okay to take, right?
Yeah, so like the first line treatment, if like your warm compress, your lifestyle modifications don't work, first line treatment option would be a non-steroidal anti-inflammatory drug, your ibuprofens.
And so it's okay.
Yeah, which actually help decrease the levels of prostaglandins. So it comes in again.
Ah.
And then decreases the level of uterine contractions that you feel and
That's
decreases the
why.
pain. So that's where it comes in.
So
it's the best.
So no, just a fun fact actually. So we kind of like grew up with Midol because we had that when we were in high school, all throughout college. But medyo nawala yung brand when we were exiting
Why not?
college.
I realized that I'm like, it's such a brand that I was seeing when I'm in my teens, and then now again.
It's having a resurgence.
But no, I'm really thankful for that because so someone in our office, like I already know when she's gonna be absent every 4th of the month. As in a 4th of the month.
Is it
"Papasok
Jen?
ka ba?" No, it's not Jen.
Is it
Tago natin
Celeste?
si Anika. No, because she gets debilitating dysmenorrhea, but she doesn't have endometriosis. She had everything checked na. So Midol is something I always recommend. I'm like, you need to stock up on Midol. So we have to have we have in our office in the pantry that just for her.
Also, Midol kasi is specifically created for period pain. So sakit sa puson, sakit sa likod, sakit sa ulo. Anything related to your period when you have dysmenorrhea, Midol is the first, line of defense. So what about your lifestyle changes, Doc Elva? Can sleep, can food, can exercise affect your pain when you have your period or dysmenorrhea, or it has nothing to do with? Kasi alam mo sometimes when you have your pimples or something,
Looking at me.
people are like, siguro kumakain ka ng oily food.
Oh my God.
So I don't know if there actually is a relation with food and what you eat and how it affects, I guess, your skin.
yeah, dysmenorrhea.
And where am I going with this?
Well,
And
I mean, I
dysmenorrhea.
feel like holistically, diba, food really affects everything. So
Yeah,
Is it correct?
No, that's correct. Actually, if you eat foods that are pro-inflammatory,
Yeah.
they actually make your periods worse.
Like
Yun
what
pa
what
naman,
what are
that's what's yummy pa naman.
that's Ava's favorite foods.
Diet.
Inflammatory.
Inflammatory.
Foods.
Everything that's good in the world
I
is
know.
bad
Why?
for you.
Why? I
So
hate
the
that.
dairy, the cheeses, the
Yeah.
creams, the high sugar.
Milk tea.
Yes, that's
That is
pro-inflammatory.
super nakaka-inflame ng
Yes.
But ang
everything. No, but and then you feel like, I don't know if you guys feel this. I feel like shit after.
No,
Like
that's
recently
true.
I drank one because I was like, oh, I'm gonna treat myself to one because I had a overnight shoot. And then alam mo yung parang like, it's so, you just taste the ingredients are so artificial, and my tummy was so bloated after, and I felt like throwing up. Because
I guess
also
it
the
depends
size, ang
what you
laki.
drink. I've been having a hojicha oat milk. It's so good. So it depends. Or
Yeah.
yours is probably
The
mine
oat milk
was
is
brand.
okay. The oat milk is a milk substitute.
Yeah, pwede
So
yan.
you're fine with the oat
Yung mga
milk.
choices mo pala is what's
No, but
wrong.
it's also the artificial sugars.
No, but
I think,
boba's the
processed.
best.
Yeah.
Anyway,
Wait,
sorry.
no, wait.
Got-
What are the
got
other
distracted.
anti-inflammatory foods?
So things that you can eat to help with your period include dark chocolate.
Oh, really?
I'm gonna
Yeah, so
improve that.
so people crave chocolate when they have.
Yeah.
but
Why
they-
do people crave when they have their period?
Because it helps relieve the symptoms. So dark chocolate has increased magnesium content, and magnesium actually helps decrease the crampy pain.
Okay.
So it helps them with the
Oh, dark chocolate is such a great ingredient.
Yeah.
It's like an aphrodisiac
Cocoa.
too.
My favorite animal is Ava on her period.
Where did you learn that?
I just picture you
I
like,
saw you pa getting so excited to say it. My
Loser.
favorite animal.
No, so I want to know kasi before we have our period, there's this like, I'm getting my period. You know that phrase that all women say na parang,
Girl,
"Oh,
they
it's 'cause
use
I'm-
it as an
No,
excuse
that's
to get mad at their
true.
husband. Like, I'm
Yeah,
getting my period.
I'm getting my period. So
Like,
that's my
last week
saltik
lang yun
sila.
ah.
Yeah. So when a woman starts a sentence with I'm getting my period, already have your snacks prepared.
That's true.
for them.
That's a good husband that has that.
Diba? It's like I'm getting my period. Can you ayan na. Why do women crave? Is it because when you're about to get your period, you have all these hormones just going up and down, and you're like, I think I need mango and bagoong, and then guava, and also like chicharon bulaklak. What is it?
Specific.
So it's the decreased levels of estrogen and progesterone that kind of triggers the low mood. Like before your menses, you feel like crap, you feel the headaches, you feel everything
Sluggish.
Yeah, and you feel the fatigue, you feel the weakness. So all of that actually comes into you looking for foods that will actually make you feel better. So aside from dark chocolate, things that you can actually eat more will be like leafy vegetables, the high fiber and
Like
calcium.
mongo?
Like
leafy nga.
I don't know. I'm just thinking mongo
that's
has a lot of
lentils.
like.
That's gout.
Okay, sorry.
kidding.
So leafy vegetable like kale.
Like
yeah,
kale.
more like more of the
Spinach.
salad. Yeah, the salad contents with
Green
increased fiber.
leafy.
Yeah, green
But-
leafy vegetables.
Doc, what about exercise? Can it help?
Yeah, exercise
Malamang,
can actually
Ava, hello.
help. It, no, but it's a good question.
Okay.
See? Ikaw talaga.
I'm sorry.
Okay, no, go lang.
Doc likes me more. Go.
So, for a general healthy person, right, it actually triggers your receptors in the brain, like releases the happy hormones, and those are natural painkillers.
Yeah.
So it actually helps with the period pains.
Yeah.
That's super helpful. I mean, exercise always helps in general.
No,
Yeah.
but when women and when girls have their period, we use that as an excuse not
not
to
work out.
exercise because we think like we're gonna feel better. But for those
true.
listening, why don't you guys just
Just
go for a walk?
Tama.
Yes, get your steps in. It's
Yeah.
very low grade,
low impact.
low impact cardio. Steady state lang siya. And you'll never regret going for a walk. You'll never be
That's
like, oh, I
so
shouldn't have
true.
gone for
That's
that
so
walk.
true.
Alam mo yun?
That's better than just lying
And
down,
scrolling on your
yeah.
phone. Like, listen to the podcast, go on a walk, and learn something new. Be productive while you're suffering.
So you know how when you're in your period, sometimes you feel like very sluggish. When's it a good time to rest? When's it a good time to like, okay, I'll push myself and walk?
It's very important to listen to what your body feels. Nobody is the better person to like evaluate how you're feeling than yourself, right? So leading up to your period, it's very important to get that 6 to 8 hours of sleep, because decreased sleep duration and increased stress levels actually make the dysmenorrhea worse.
Yeah. Actually, decreased sleep makes anything worse.
Yes.
And it's
you don't wanna
also
see us with no sleep.
Exactly. I watched a I was gonna say a study. No, it was just an Instagram reel.
Don't pretend you read it.
Yeah, where
You
this
scrolled
woman
through.
was saying that all the studies have been done on men. So yes, men need 7 to 8 hours, and before sinasabi na women needed the same, but now the research shows that women need 10 hours of sleep
Oh my God.
to regenerate, especially when you're pregnant, when you just gave birth, because our body needs
Oh
it.
my
Our
God.
hormones are very different from men.
That's
So I've been trying to hit 9 hours of sleep.
That's amazing.
I'm in
gonna
bed
try.
at like 8.
I'm gonna try to do
Tapos
that tonight.
one tip for those listening, when you want to sleep early, it has to be, you have to put your phone either in a different room or somewhere far from your bed na hindi mo maaabot. Because once your phone's there, your brain can decompress. But if you're on your phone in your bed with your phone on top, hindi ka makakatulog.
You
your
were
mind
like
can
that
shut
though
off.
before. You always had your phone. So
I know, but I have
any time of the
I have
night
a different
and you reply.
I have a different routine now.
Yeah,
So I
saw
put my
last
phone.
night.
Yeah, I put my phone out, and then in the morning, instead of grabbing my phone first and using that blue light to wake me up, I always use the sunlight to wake me up, and I spend 30 minutes without my phone in the morning. And honestly, I think I'm
Is
better
that
than
true?
all of you bitches.
How many days? I want to know.
No, it's been like a month.
I can't believe
Yeah,
it.
so-
You're a different person. That's amazing.
Yeah, so I'll brush my teeth first. I'll do everything before grabbing my phone, and then you know
but
what?
I'm sure inside you're like, oh, I get it.
No, but it really makes me a more balanced person overall
love
in my
that.
head. Try nyo lang once.
It's such a good recommendation.
Diba?
People rely so heavily on their phones and they don't realize it's causing them insomnia.
So much. And
Yeah.
everybody listening probably thinks I'm busier than the next person, but you're not.
True.
Diba? That email can wait, that text message from your partner can wait, your to-dos and deliverables and everything can wait 30 minutes for you to have like a balanced circadian rhythm. I'm talking about like in your body, you have to it takes time for your body naturally to
Yeah.
wake up. And
I
when
love
you're
that.
constantly faced with the blue light, it's really
That's
messed
a whole
up.
topic in itself. But I'm
Yeah,
going to
that's a
go
whole
back
topic in
to
itself.
period
Sorry.
and menstruation. But I want to go back and talk about for people who are starting to experience menstruation, like early on, the first time you ever get it, you're like, what is this? And I don't remember in school being taught that you're gonna bleed. You're kind of just, your peers talk about like, oh, I got it first, or oh my God, she got it so early.
Can I just say, when I was in first year high school, I remember this so clearly, 14 years old, all my whole barkada had their period. I didn't get mine.
Why? Because you're younger.
Because I was a bit younger, and also I got it late, I feel like I'm also kind of taller. I don't know.
Okay.
Because people who get it early, they say they
is that a
don't grow
thing?
as tall.
Is
I
that
don't
a
know.
thing?
So
That's
it differs per person, right? It also varies in terms of like age.
Yeah.
So like it also depends on family history. Because if your family members, your mom, sisters got it later, you have a tendency to like
Get it later.
Get it
Yeah.
later too.
Yeah. So, okay. So anyways, and then wait. My story doesn't end. So then all of them were kind of exchanging notes on what napkins they were wearing. And I was so like losery
Trying
and
to
like
fit
I was
in?
like trying to fit in. Like, yeah, I use Whisper with Wings. And then and then when I finally got my period, I didn't know how to use the wings. I was like, what do you do with the wings?
What is it?
Yeah, I never knew how to use it. And then I asked for George. I was like, George, do I put this under? And she was like, yeah.
That's so funny.
So parang we really don't learn how to use it
No,
as
yeah,
teenagers.
that's
How to use
true.
napkins. Tampons are totally non-existent
Yeah.
during my time.
And we weren't allowed to use them.
Yeah, my tita was like, you're gonna get devirginized because if you put the tampon in and out,
No, that's mom.
no, that was Tita Georgie.
Oh.
Yeah,
But some of our cousins have it. We're like, oh my God, she's so bad.
yeah,
Anyway, and so going back to that, when you're young, no one tells you about it. And parang, what do you have patients that are just starting? Like, is it too early for them to visit you?
No, that's not too early at all.
Okay.
So anybody who's experiencing any form of pain or aren't like comfortable on explaining to their daughter what having a menstruation
Yeah,
is,
okay.
because part of the explanation is you can get pregnant, right? Some parents can't even begin to discuss that with their children. So they can come to me so that the counseling is complete.
Yeah.
Because we have to, sometimes the parents, especially of the older generation, they're used to like just bearing with the pain. So they don't even know what they can offer their
Yeah.
child. To
or they
help
have
them.
like myths na parang hindi ka pwede maligo.
Yeah.
Hindi ka pwede magpa-massage.
What about that myth where they're like, put your first period on your face and you'll never get pimples.
die.
You did it, no?
Doc Elva did it. Did you do it?
Well,
You did.
that was the belief of the
That's
the
really,
parents.
that's really
Yeah.
I
You know
actually was
what?
like, I wish I did it.
Yeah. No, ang dami natin mga ganyan.
Yeah.
Is it true? In fairness, maganda yung skin mo ngayon.
No, but it's not true, right?
No, and then they also tell you something about jumping.
We have so many superstitious stuff that don't make sense, but we do it because we're like, it's tradition. But
Might as
you know,
well.
that's a weird one. I'm judging you for that, Doc Elva. She's like putting her.
Don't worry, I
period on her.
wish I did it.
Wait, before we go to the advice on the listeners, I will say this to our listeners, giving unsolicited advice. If you're a parent of a 13, 14, 15-year-old, consider taking your child to the OB-GYN when she gets her period. Why? It's not because you're encouraging them to have sex or anything. It's more to educate them, first of all, what a period is, why we get it, what discharge is, how to cope with your period, and what to do when you're about to expect your period or during. Because as a parent, if you don't feel comfortable teaching that to your kid, that's totally normal and fine. You can take her to a professional and have the professional do it. I have a friend in Hong Kong. Her daughter's 17. She's off to college. She's like, I don't feel comfortable talking to my daughter about sex, but and I just told her, like, dude, you need to take her to an OB-GYN. So whatever she doesn't want to discuss with you, diseases and all that, she can do it privately. At least you know she's informed and she'll be taken care of. Because
That's the best way to go about
diba?
it.
Because if you're listening to this thinking, oh my God, that's so like weird. I'm not gonna take my daughter to the I never did that. I snuck out and I had to see a doctor behind my parents' back. That's the old style. Yeah. Now it's all about taking control, being informed, and understanding and helping your child understand
Navigate through
their menstrual cycle and adolescence.
Yeah.
Anyways.
Yeah. That's very good advice. Okay.
Thank you so much.
Yeah, because we have to give them the tools to be able to manage themselves,
Exactly.
to be able to take care of themselves, and to not just bear with the pain, but be able to live with the pain and live outside of the pain. Because
Agree.
you have people who can't go to school or work. I've had classmates who miss school days
Because of that.
Yeah.
Is it
That
true
is
that
not in our medical leaves.
No, I was gonna say, is it true some companies have like dysmenorrhea leave or like a leave because of
Yeah, I just
super
said
bad?
it. Parang wala.
Wala?
Yeah, there's maternity leaves now, and they're adding paternity leaves, but no
I've
dysmenorrhea
heard
leaves.
of that though.
Well,
Maybe
they can just
abroad.
take Midol.
I've heard abroad.
It's true. Abroad, diba?
Yeah, yeah.
Maybe eventually one day. But going back, Doc, what's advice that you would give patients that come to you that are still experiencing pain pag meron sila?
So aside from like getting proper sleep, it's very important to de-stress
Okay.
during your menses. So that's why some people just prefer like lying in bed, not just because of the lethargy, but because it helps them unplug. So unplugging is also like a necessary step
you
in
connected.
relaxing. Aside from that, you can do meditation exercises.
Breathing in and out.
Yes.
What about in terms of like water? Can you drink hot water, cold water? What are those things that help?
Any in terms of like temperature is okay,
It's
but
okay.
it's very important to adequately drink 2 to 3 liters of water per day.
Okay.
So hydrate.
It actually improves the water retention.
Talaga?
Yes, it does.
But what about my friends that get like dizzy? Some of my friends get dizzy. Like she says na parang it gets super painful here.
So that's also related with the prostaglandin levels.
Okay.
So if you get headaches, you can take ibuprofen
Okay.
to help with the symptoms. Fun fact, orgasms can actually decrease your period pain.
Here
No
is the
way.
bobble from Jelly Time.
So Jelly Time can help that.
for those listening and watching us, and you are experiencing period pain or dysmenorrhea, just grab a pack of Midol, have it in your bag, and just think, whenever I feel like I'm about to have my period, I'm going to pop one in and prevent that period pain because it's such a relief.
Yeah, and you don't have to deal with it.
Yeah.
Kaya mo with Midol. Oh my God, we need a dysmenorrhea kit with Midol and Jelly Time. Literally, that would
With
be
the
amazing.
bobble.
Yeah, of course. Thanks, Doc. That's a really interesting fact that you'll see on our feed sooner or later.
Thank you so much, Doc
Thank
Elva.
you, Doc.
Thank you.
Thank you for having me.
Thank you.